Gambia has joined list of African countries to have received second consignment of medical material from China as part of support in the fight against COVID-19. Chinese business tycoon Jack Ma had initially donated thousands of health equipment worth over $1 million to Africa. Gambian health officials commended China for the support, saying it can greatly help in the fight against COVID-19. Here is more details of that in this report. The Chinese embassy in the Gambia handed a batch of medical supplies from China to reinforce ongoing efforts to contain the spread of COVID-19. 2 ventilation machines came along the second delivery Alibaba Global e-commerce group, in addition to thousands of face masks and protective gears from the Government of People's Republic of China on Monday. Ma Jinchung, Chinese ambassador to the Gambia, described the intervention as a symbol of the much cherished friendship between the peoples of China and the Gambia.
I'm happy to attend the handover ceremony of the second batch of medical supplies donated by Jack Ma Foundation and the Alibaba Foundation. This is the fourth time when medical supplies from Chinese government and the people landed in the Gambia. Such practices are the clear demonstration of our efforts in materializing the vision of building a China-Africa community of a shared future and common health.
Wanja Karia, representative and country director of the World Food Programme, said a solidarity package has been included to support the fight against COVID-19. Our organization has been responsible for all logistics in the shipment and delivery of the donation from China.
These supplies have reinforced the capacity of the Gambia's health system to contain the COVID-19 outbreak. We are indeed grateful to you, Your Excellency, the Ambassador, and remain indebted to your government of China, Jack Ma Foundation, and of course the WHO for this much needed assistance. It is a moment like this that we know who a true partner is, a friend and an ally.
WHO representative in the Gambia, Dr. Desta Terune, stated that even though the number of cases in the Gambia is low, more mechanisms need to be in place as a signal of early warning.
The number of cases in the Gambia have been few, but we still have to review also how we are doing our business in terms of testing. What we see is that the number of people that we are testing may not be to the number that we require to test. This is something that we are reviewing together with the other partners. The Ministry of Health is reviewing this, and very soon we may be making some adjustment also to make sure that we are really safe enough to move forward with the situation. But from the forecasts what we have some projections that show that in a few months' time we might be having quite a number of cases. So for that we have to prepare, and these are the most important things to do.
Gambia's Minister of Health, Dr. Amadou Lamin Samate, recognized the importance of the items in the fight against COVID-19.
These go to strengthen our resolve, to strengthen our commitment, to strengthen our collective strategies to respond to the COVID-19 pandemic, and also to contain the disease in this country. Now, the current presentation today, we have seen a long list of very important items, but of course, the name ventilator has become a household name across the length and breadth of the country.
10 cases in the Gambia contributes to a global infection of more than 2 million people, with over 152,000 deaths since the outbreak began late last year. Europe, with a more than 1 million confirmed cases, and the Americas are nearly 1 million cases, are the worst affected regions. Cases in Africa region are about 14,000 as on April 19, according to the World Health Organization. Reporting for Africa News, I am Amadou Kante. China continued to support Africa in the fight of COVID-19.